And what does he do when they don't open up to him and they don't trust him? I get sulky, yet easily off. It's not right to get sulky with your children, he says. So you see, once again, psoric reaction. And intellectual sugaring of the pill. Okay, I shouldn't get sulky with my children. I shouldn't contradict. That's the interpretation. And he finds the excuse. He sugars the pill with philosophy. A parent should not get sulky with his children. He is also angry with his patients when they are cunning and slyness, with their slyness, when they don't trust him. This is the cowardice and anxiety of the psoric person and of the lycopodium person that wants to have a good image to his patients. And when they don't trust him, although he's very good at and diligent at his work, he is bothered when his patients accuse other dentists. How do we interpret this? He is bothered when his patients accuse other dentists, because being a psoric person and a lycopodium person that is very much interested on his professional image and his social image, he is very much afraid that his patients will not be pleased from his work and that they will accuse him to others. Social image. He is so anxious that things will not go well, his patients will not be pleased, and that they will accuse him also. That's why he is very much bothered when his patients accuse other dentists, because he says that they will accuse me also. Once again, a psoric reaction. He is probably syphilitic sister, puts her obligations to her parents on his back, and he complains about it, but he doesn't do anything about it. In the end, he, as I imagine, as I suppose, he does all the job himself. That's why he says that after his father died, he had so much to administer, because all things were on his back. The doctor quite correctly says that this patient is coward 2 to 3, I would say 3. Easily offended, psoric person, easily offended yet never reacts to strangers. Never reacts to strangers. Coward, very psoric. Introvert, 2 to 3, very psoric. Only to his wife, yet he discusses all things with his wife, 100%, he said. This is a lycopodium behavior. He is introvert because he doesn't want to talk his personal matter to others, and so as not to spoil his image to others. Yet with his wife, if she's a good wife, he can talk about all things. He is in favor of dialogue, of communication with his wife. He is afraid of financial problems. afraid of insecurity, afraid of bankruptcy, afraid of Nazi. Why? Because Nazi, I think this is the correct, Nazi, afraid of people who are violent, who are racists, afraid of being beaten. That is a very great fear of lygopodium, of a psoric person and especially of lygopodium. Afraid of violent people, afraid of getting, of being punched in the face, of being beaten. Muscle tension at the neck because he is very stressed and worried, and this is transferred to the muscle tension of the neck. He has imaginary dialogues. He will say this to me and I must answer this way. He's so coward that even when there is no contradiction present, he thinks of what may have happened, what may happen with a certain person that he has even slight contradictions, and he wants to be ready to answer back and not be overwhelmed by the other person, because this is the story of his life. He is submissive, and others put burdens on him. Others press him. When pressed, others press him, and he doesn't react. So he is all the time afraid of contradictions. Psoric. Spanish literature, he reads and translates. Hebrew mystical philosophy. He writes critiques and comments on films that he has watched and forwards it to others. A very intellectual and cultured way of showing himself in a psoric way. Or mythology association. Only a psoric person could deal with such a hobby. Would like to teach literature. Once again, the intellectual person, the lygopodium picture of a person who likes to teach. Critics and translations to blogs. Psoric, smart because he has read a lot and is intellectual, yet no good memory, not quick-witted, so afraid of doing mistakes and spoiling his image to others. So when he has a presentation, he has a great anxiety before a presentation, but after 1 or 2 or 3 minutes that he started the presentation, he is very fluent and does well, performs well. This is a psoric anxiety, and this is a psoric behavior, and especially a lygopodium behavior. Eats quickly, no chewing. A great lygopodium characteristic because he has this weak digestion. Distension 2 to 3. All food becomes air in his stomach and in his bowels. Where's bean? Also lygopodium. Where's late eating at night? Also lygopodium characteristic. Indecision. Very psoric, very lygopodium because he thinks a lot, he's very intellectual, and he thinks, what if, should I choose this or that? These things are in, he thinks of the cons and pros, the things that are in favor or against this option and that option. Very intellectual, thinking of this, thinking of that, thinking of what may happen if he chooses this option. And what about his image? And what about the consequences? Indecision 3. Very psoric. What we've said about sex, it's a psoric, submissive behavior. Coward even to sex. Intellectual even to sex. Not cheating on his wife. Being coward on cheating his wife, although he would like to. All these things that we have said drive us to the quite certain conclusion that this person is very psoric, miasmatically, and that he is psoric in the way a lycopodium is. That is, he is very intellectual, very diligent about reading and learning things, wants to have a very good psoric, cultured, intellectual, refined picture and language. He is very coward, very submissive, very worried about things, very insecure, very indecisive, and has all the digestive problems of a lycopodium. So, in the end, we will give lycopodium. So, we have decided the miasmatic aspect and the essence of this individual, and it's the essence, the typical essence of a lycopodium constitutional influence. It's a typical lycopodium constitutional picture. Differential diagnosis. From sulfur. Sulfur also is psoric. Sulfur also is very intellectual, but the way he deals with knowledge is different. Sulfur is not so diligent in learning things. He has a superficial knowledge and reading about things, and he reads and is interested more in very weird things and mysterious things, like the Bermuda Triangle, the aliens, the theory of relativity, and so on. Here we have a person that is very intellectually in a lycopodium way. He is very diligent about things that he learns, and he doesn't only read things, he writes about things, and he forwards it to others. He translates things. You have to be very diligent and very very active to do such things. Sulfur is usually very lazy about things. He reads a little thing about many mysterious subjects, and then he projects that he knows many things. But it's a superficial knowledge. Sulfur is the dirty, ragged, superficial philosopher, the shallow philosopher. While here we have a very diligent philosopher. Sulfur is very introvert also, much more introvert, and Sulfur doesn't easily speak to his wife about his personal problems. He doesn't have the physical characteristics of sulfur. Sulfur is very hot, very offensive, very much sweating, and he is not so submissive as lycopodium and not so coward as lycopodium regarding his wife, his children, his sister, and his patients. He is more sloppy than this man. He has some characteristics of sulfur, but he is lygobodium. So I prescribed lygobodium 1M, and after 1 month, the doctor who took the case, I didn't see and met the doctor, the patient. The doctor that took the case says that in 1 month his sleep got better 2 to 3. His muscle tension to the neck better 3. Has gone completely. His irritability got better 2. His anxiety got better 2, and his distension and problems with his bowels better 2. So, this is the way we deal and analyze with the method of the classical miasmatic constitutional homeopathy. As you have already seen, noticed, we focus on the whole. We focus on the background of the patient, and we focus mainly on the miasmatic aspect of the patient. That's why I call the method that I have founded as miasmatic constitutional homeopathy. We focus on the miasm, and we focus on the constitution, and especially on the essence and on the whole picture, and mainly on the characteristics of the individual during the state of clinical health, and not on the symptoms of the patient during the acute illness. Thank you.